When you were practicing full time, did you ever come close to burnout? Do you understand, what that feels like? And I don't know, just more of a personal interest. I mean,
Yeah.
or discussion about it. Did you see it? Do you get it?
Trust me, I got it. So when I was,
especially with twins, right?
Yeah,
especially
twins,
with twins.
and then I had another one. So what was I thinking, right?
Oh boy.
I think part of the problem with burnout is it's so hard to recognize until you're so far in. But what I was experiencing was kind of lack of empathy towards my patients, and so that was very hard because I'm naturally a very empathetic person and very compassionate. And then so I would go in, and I would struggle trying to have these conversations with patients and their families, and they keep wanting me to come back and talk to them, which I get it as a family member, who've dealt with sick family members. I want the answers. I want to talk to the doctor. And so when I was starting to feel that way, I knew it was time to reevaluate. What do I need to do in my life? And so, and sometimes, unfortunately, it's not just cutting back in your hours. Initially we always thought that the key to burnout was go take a vacation, you'll feel better, and then you'll come back. And actually, that's not really the case. It's really spending that time on autonomy, being able to choose your schedule. So that's one thing that we had really focused on was being more flexible in our scheduling, and also looking at the number of encounters we were having on a daily basis, and know when to call in for help. And that's where I had originally struggled with, was having delegation. I'm definitely a control freak. I don't know if anyone knows me out there in the world, but I like to make sure everything's managed, and more in such a way that I just want to make sure it's done really well. And so I was having trouble delegating. So I was seeing, 20 patients a day and trying to be a CMIO and a medical director. And so I was definitely feeling, again, that first symptom for me was really lack of empathy. Then once we started making some adjustments to scheduling, and that I was able to help identify the need for delegation more, that helped me be able to address my burnout needs.